I, on behalf of Tura Christian Hospital, welcome each and every one of you to this program of launching of World Breastfeeding Week 2025, which is celebrated from 1st to 7th August every year to create awareness of the importance of breastfeeding for newborn. I thank our government officials for giving us this opportunity to host this program. I believe the initiatives by the government will encourage every mother to breastfeed their newborn, thereby improving overall health of the newborn.
We all know that breastfeeding is one of the smartest and the most cost-effective public health interventions, because we know that it's something which is done by everyone. But why do we celebrate it throughout as a breastfeeding week? Because it has so much importance in the survival of a child. As we know, breastfeeding prevents 20% of the newborn deaths, 13% of under 5 deaths. There is 11 times lesser chance of diarrheal mortality, 15 times lesser chance of pneumonia and related mortality. The benefits of raising the IQ, prevention of the non-communicable diseases, lesser hospital stays of newborn, and of all, it has many maternal benefits including cancer prevention. And overall, for the health system, it reduces the burden of disease and cuts down on the healthcare costs. Yet, despite all these proven benefits, many mothers still struggle to breastfeed due to lack of support, cultural practices and beliefs. And I'm sure you all will agree with me on that. We as healthcare providers, we continue to give support not only to the patients that come to us, but also to our fellow colleagues in our workplaces, because most of the time we find that there is no suitable space even for the staffs to give breast milk. And another thing I would like to stress during this breastfeeding week is to make the community and also the healthcare providers aware of the IMS Act, which is Infant Milk Substitute Feeding Bottles and Infant Food Regulation of Product Supply and Distribution 1992 Amendment Act. It's on its roles and the key provisions of the Act. Also, I would like to stress the hospitals on the breastfeeding policies to be displayed in all the hospitals. So, I would also like to inform you that from the public health point of view, even in the community, we have our partners, that is the ICDS, we have the Anganwadi workers, we have the Ashas, who are every day giving awareness and supporting the mothers, especially the young mothers and adolescents on breastfeeding, and supporting the families. We have the Ma program in the community where the Ashas, by using the flip charts and the MCP cards, we also urge the healthcare workers, especially in the facilities, to make use of very important tool, that is the MCP card, on educating the mothers on the importance of breast milk. Also, I would like to request the healthcare providers, whenever you're giving counseling, kindly tell them about the importance of colostrum, about the kangaroo mother care, of complementary feeding and initiation of early breastfeeding, because in reality we find that even at home mothers do not start breastfeeding within 1 hour. And not only that, we talk about the exclusive breastfeeding, but in reality in the field the parents are starting to feed children as low as less than 1 month, and we have incidents and cases where the chances of diarrhea, where the chances of pneumonia, where the chances of infections is and children succumbing to deaths we have seen in the community because they are not putting a stress on the exclusive breastfeeding. We know that when you think about the economic point of view also, if parents they stress on breastfeeding, there is so much of less out-of-pocket expenses. And the more we breastfeed, the more milk production, as we all know. But the awareness and the practice amongst the mothers is very, very low. So as health providers, we should always keep on counseling, not only during the lactation, during the delivery or the postnatal period, but as entirely during the 9 months of antenatal care.
You are the unsung heroes behind the... As we all know, besides diarrhea and pneumonia, breast milk has got all the nutrients and the optimum needs for the growing baby, especially for the first initial life, that is first 6 months. We all know that besides diarrhea and pneumonia, which is very common in society, breastfeeding also gives the needs which will prevent the babies and the children from diabetes or from obesity and even from other illnesses like hypertension, and it's set even to increase the IQ of the babies. And coming to mothers, it also helps the mother in many ways. For example, like all we know, it helps in preventing PPH, that is postpartum hemorrhage, which helps to control the bleeding following deliveries. It also helps the mother to regain back to her pre-pregnancy state and also help in losing the extra weight gain during the pregnancy. And also it helps in acting as a natural contraception also. And above all, it acts as a bond for mother and her children, which is very important. So coming to these short benefits, I would like to stress on why after coming to know with all these benefits, so many benefits are there, why are we not being able to practice this good practice of exclusive breastfeeding? By exclusive breastfeeding, we all know that it is milk, mother's milk and only milk. Only mother's milk, nothing more or less than mother's milk. It means that. I would like to share from my personal experiences. As we know, the data says that though breastfeeding is been supported or promoted, it is said that only around 60% of the mothers, they do breastfeeding, and only around 40% of the mother, they practice exclusive breastfeeding. That's what the data says. So let me just, from my experience, let me give some tips in our areas why mothers are not being able to practice this exclusive breastfeeding. Well, after delivery, we can all see in the wards that all the mothers, they are ready for breastfeeding. But very soon, say after a few hours or maybe the next day, when we come for rounds, we can see many of the mothers, like besides their bed, we can see the feeding bottles along with the formula feeding. It's a surprise actually because they don't consult. Most of them, they don't consult. Of course, some of them, they do consult, but we discourage. But many of them, they don't consult even the staff or the doctors, and they used to start on their own. And when we ask them, why are you starting all this? The first answer they give is, Chungja, Okjana. That is the common answers they give. So that is the thing. And I would say that is the first step of failure to a successive exclusive breastfeeding. What happens here is, once a mother starts this formula feeding, the cycle goes on. The baby is well fed, the baby will not demand, and then since there is no positive reflex, since there is no reflex from the breast to the brain, as we all know, the brain will think that it doesn't have to work, so it will not release the hormones required for breast milk, and so the cycle goes on. The milk production will decrease, and so it will go on, and the exclusive breastfeeding practice will come down. That leads to failure. And another one is, of course, latching. Proper latching, to teach them proper latching is very important from our part, because what happened is, many of the mothers, they don't know. We have to educate them. Proper latching, not only latching around the nipples, but including most of the areola also is very important, because if there is proper latching, there will be a proper sucking reflex also, a proper sucking, and at the same time it will prevent cracked nipples, which is one of the commonest cause of a failure to breastfeeding. Once cracked nipple happens, it's very painful, and the mothers, they don't want to continue breastfeeding, and at the same time it will lead to engorgement and mastitis, and we know the complications after that. It will lead to surgical intervention following to again failure of exclusive breastfeeding, successful exclusive breastfeeding. So all those things are there from from maternal challenges. But at the same time, of course, some mothers, they have to go for early works also. So in those cases, some of the mothers, they cannot complete the might find it difficult, but in those cases maybe express milk and storage can be practiced. That education can be given to the working mothers. So those are some of the challenges which we face daily in our wards. And some of the things which I would like to share with you all is, in our college days, our professors used to say, cow's milk are for cow's babies, cow's milk are for calves. And the second dialogue they used to say is, breast milk will not come out like tap water immediately. So those things we have to educate our patients, we have to educate the mothers to be patient, and we have to build up the confidence also.
I commit myself
to actively support breastfeeding for all the mothers attending maternity service in our hospital. I will do every possible effort at my end for protecting, promoting and supporting the breastfeeding in our hospital. I will ensure all the mothers are supported for initiation of breastfeeding within 1 hour of birth, skin to skin contact, discouraging prelactal feeds, and use of milk formula. I will also ensure supporting mothers to practice exclusive breastfeeding during their stay in the hospital, both in normal and cesarean deliveries. Thank you.